onset, peaking in intensity within minutes. So a panic attack is kind of like that phobia for an individual item. The fear just kicks in just immediately when the situation that provokes it is around. These attacks are spontaneous and not associated with a specific situation or object, so that's what differentiates them. You know, a specific phobia is a thing or a situation that you know is going to happen and the person has a fear. Here, a panic disorder, it's also spontaneous, peaks in intensity quickly, but it's not associated with a specific situation or object. So a person can be going along and all of a sudden they're breathing heavy, they're sweating, they're anxious, they can't move forward, and they are just wild-eyed looking. I mean, it's kind of scary. They have to have 4 of the following symptoms, and you will see these are all somatic symptoms for the most part. Palpitations, pounding heart, sweating, trembling or shaking, shortness of breath, sensation of choking, just muscles constricting in your throat, nausea or vomiting, abdominal distress, feeling dizzy, unsteady, lightheaded or faint, chills or heat sensations, even more, paresthesias, numbness or tingling sensations, and then these are kind of interesting for this one, derealization, a feeling of unreality, like this is not even a real moment right now, and everybody uses the word surreal now, but it's kind of that depersonalization, derealization, and then depersonalization is being detached from yourself. It's like you see yourself from the outside in. I saw myself, but you're talking like you're over here with something's happening. Fear of losing control or going crazy, fear of dying. Now that would be scary. I mean, really scary. At least one of the attacks has been followed by 1 month or more of one or both of the following. So you have to have at least one of the attacks that has been followed 1 month or more by one of the following. Persistent concern or worry about additional panic attacks or their consequences. Could be about just all of a sudden now it's become a thing on your mind. Or a significant maladaptive change in behavior, such as avoiding things. A behavior designed to avoid a panic attack, such as avoidance of exercise or unfamiliar situations, or some irrational belief: if I don't go over here, if I don't see this person, if I don't watch this show, if I don't go to this location, I won't have a panic attack. So you have to have that. And of course, the disturbance is not due to the effects of the substance, because you can get depersonalization, derealization when you're tripping on drugs. Okay, so it's again the rule out. So let's see what it's like to have a panic disorder. And this little clip is more of an abstraction, a collage of things, but it will communicate to you what it's like.
No, not again. Why does this always have to come out of nowhere? It's really hot in here. Catch my breath. I can't catch my breath. My hands are shaky. My heart's definitely going too fast. My pulse is too high. My pulse is definitely too high. I wish someone was here. No, they'll think I'm crazy. Probably. It's cold. Why do I feel so heavy on the chest? Are symptoms of a heart attack again? Chest pain? Yeah, that's it. Definitely having a heart attack. My muscles so tight. Where did my legs go? Feel my legs. This is so weird. It just feels like I'm on the other side of the room. Unreal. Looking at myself. Unreal. Completely unreal. I really don't feel like I'm going to be sick. I wonder if these will help. This will calm me down. This is not a good idea. I'll take some just in case. Did I overdose? Probably overdose. My head's going to explode. I'm not going crazy. Probably going crazy. I lose control and do something stupid. I hope no one sees me like that. I really don't feel well. I think I'm dying. Wait, I know this is a panic attack. My brain just messed things up and triggered fight or flight at the wrong place and the wrong time. Okay. I'm just going to lie on the couch, clenching my fists, and it'll pass. Always does. Nothing bad ever happened. Just breathe, relax, calm down. I really wish someone was here. Do I? No. They wouldn't understand. How would I even explain this? It has no particular reason. This is stupid. I'm so tired. I don't want anybody to see me like this. If I get a panic attack in public, everybody will be looking. No. Yeah, I'll stay. It's safe now. It's safe.
So you see what they do. The clips are actually kind of good because they're doing what people do who have it as best I can possibly imagine they do it, is they know the panic is happening. They're not trying to make it happen. It's just happening to them. And then there was that depersonalization. that, and the derealization is not a real situation of detachment. So she's talking to herself, you know, she's saying nothing bad ever happens, I'm just gonna lay here, but then you hear all this rush of other talk going on about what's happening to her. So that must be a pretty scary thing to experience if you have it. I mean, I don't know how to deal with that. And I do know people who have panic disorder, and it is, when you see it, it's like, you don't know what to do. I mean, it's really pretty unnerving. Diagnosing it depends on the detailed clinical assessment, because you have to figure out how they act, how they feel. You have to get all those somatic symptoms. Then you have to understand how they're reacting to things in the 1 month after they've had one of these attacks. No specific lab test. Medical workup rules out other conditions. What's the most common disorder that you need to rule out? Well, there'd be schizophrenia, but in medical, what medical condition would you need to rule out? What's that big one? Common that causes problems.
Hyperthyroidism.
Thank you. You just cannot forget thyroid. It will obviously be on a test somewhere. I'm not saying I'm writing that question, but on a inter-rotation exam or a PANS, it's the type of a thing that has to be ruled out. Up to 35% of the population have a panic attack each year, but not a panic disorder, because they don't then come back and have these maladaptive behaviors that go with it. Okay, treatment, again, you're looking at psychosocial treatments, cognitive therapy, behavioral therapy. Cognitive therapy helps the person reframe the catastrophic thinking and expectation of panic. She was saying it, you know, she was trying to tell herself it was okay. She'd obviously been in therapy. She's had a chance to learn how to reframe it. She was reframing it in the moment. Often paired with relaxation training. I'm just going to lay here on the couch. You know, she started curling up and balling up. Then behavioral therapy, desensitization to panic symptoms paired with relaxation training. So once you start feeling your heart pounding, you start breaking out into a sweat, you have to separate yourself from this disorder that's unfolding for you. Family and insight-oriented therapy are often used as adjuncts. There are drugs that can be used, again, SSRIs, tricyclics, or high-potency benzodiazepines, first line, probably SSRIs in this day and age. Second line, benzos, and then adjunctive medications for some of the symptoms. Again, I'm not going to worry about that on the slide, just to know that the behavioral therapy, cognitive behavioral therapies are probably more important than the drug therapies, but they can be an adjunct to it to help it go along. Jessica, did you ever deal with phobias or any of these things? Did you? Were you a cognitive behavioral therapy person?
Yeah, but we didn't. I dealt mostly with like anxiety, depression, but no. I don't think of any specific anxiety. I mean, like phobias or anything I dealt with.
But if you had to say, just tell folks, I'm kind of curious from my own perspective, if you had a person that had an anxiety disorder and you were doing cognitive behavioral therapy, how long in general did you have to work with that person before you felt like they actually could see that things were better?
Quite a while. I mean, of course, I work mostly inpatient, so with adolescents, they were there between 3 weeks and a month.
Yeah.
But, you know, it just kind of depended on what was going on.
But you're usually looking at a multi-month process. It's not going to be, we're going to have a session and all of a sudden you have this insight, things are better.
No.
It just doesn't go that
No.
way. It takes a lot of patience, I think, to do it.
Yes.
And you have to have realistic expectations for the outcome. So the reason I ask for that is when you're talking with patients about therapies, it's good if you can be predictive. It will help. It requires a certain patience and focus and a diligence to the process, and things can get better. So you can help them understand what they're getting into. If they say, I'll go, and you haven't told them that the expectation is that it will take longer, they'll go one time, oh, there's nothing happened, and then they won't go back. And it's not because it won't work, it's because they didn't understand what they were going to in the first place. And then they'll come back, well, I'm not going to you because you don't know what you're talking about, and then it spirals down. So it's just like I've been telling you, Dr. Latassi, tells you about medications. The more you can predict about what's a reasonable expectation for an outcome, the more they are with you. When you just sell false hope or unrealistic outcomes and don't get what they've imagined it will be, then you don't know what you're doing. And of course, it's not fair, but that's what people will do. Okay, agoraphobia. Does anybody know anybody with agoraphobia? Okay, so 2 people know folks with agoraphobia. How bad is it?
Pretty bad.
Pretty bad?
She doesn't leave the house unless it's for a doctor's appointment.
Oh my gosh.
Yeah.
So groceries are brought in, all this stuff?
Mm-hmm.
Who does the grocery shopping?
My dad.
Okay, so you just have, so there's support to help the lifestyle. Okay?
It's a family friend of my husband's family, and she's totally disabled by it.
So locked, I mean, in the house all the time?
Yeah, it's gotten worse. I don't think she's probably left her house, except maybe for like medical stuff, probably in 10 years.
And I bet going out for the medical event is a major
Yeah, I
issue.
don't know them that well, but I know
Yeah.
my family is sad because they never hang out.
Mhm.
She can't
Can't
socialize.
do that. Okay. Let's look at it. It's marked by fear or anxiety about 2 or more of the following 5 situations. So here's, you gotta have 2 or more of these. A fear or anxiety of using public transportation, fear or anxiety about being in an open space like on a bridge or in a marketplace, fear or anxiety about being in enclosed spaces like shops, theaters, or cinemas, fear or anxiety about standing in a line or being in a crowd, and fear or anxiety about being outside the home alone. So it has to be 2 or more of those situations that would provoke the anxiety or the fear. Okay, they avoid the situations because thoughts that escape might be difficult or help might not be available. So I can't be in a place like that because I might not be able to get away, and if I get in there and I can't get away, nobody's going to help me, and I'm stuck in a bad place. So they won't do it. They actively avoid. They require the presence of a companion, or they are endured with intense fear or anxiety. So that's what they're doing. They're either going to avoid it, they're going to have to be with somebody, or they're just going to bear up under the extreme distress of it all. It's out of proportion to the actual danger posed. It's really, that's the key again, out of proportion. And the fear, anxiety, or avoidance is persistent, typically lasting for 6 months or more. So it just goes on. And it tends to be a chronic disorder. Agoraphobia is now diagnosed irrespective of the presence of panic disorder. It can coexist with panic disorder. So you can have agoraphobia specific to those 5 situations. You have 2 of these 5 that you call agoraphobia, but they can also have panic just that wells up out of the middle of nowhere, and they would be diagnosed with panic disorder. Okay, so they could be 2 different diagnoses in the anxiety group. And then finally, generalized anxiety disorder. Okay, very common in practice. It's excessive anxiety and worry. It's called apprehensive expectation. You just look to the future and you're worried or stressed about something. Occurs more days than not for at least 6 months, and a number of events or activities, such as work or school performance. They cannot control the worry, and it's usually associated with 3 of the following. So here's the symptoms again: muscle tension, irritability, can't concentrate, easily fatigued, restless, sleep disturbance, can't fall asleep, can't stay asleep, not satisfied with sleep. I have people who tell me they probably only sleep about an hour or 2 a night, but it's because of anxiety. Now you got to look at insomnia. That's another diagnosis. But I don't know how people do that. I mean, day after day after day. So much so that they're afraid in the evening because they know they can't sleep, but yet they get through a night. It causes clinically significant distress or impairment, and it's not attributable to a substance or medical condition or other mental disorder. So what is it like to have general anxiety disorder?
I would worry about things, I'd be concerned about things, and I was just stuck, kind of, my tires were spinning and I wasn't getting anywhere. Those worries really kind of took on a life of their own. Things that would be a minor stressor for someone would really, really affect me, and I couldn't kind of get over it. It was more like just a prisoner to these worries and these thoughts. And I didn't necessarily know to give it a name, that it was an anxiety disorder, that I was struggling with anxiety, that there was something that could be done about it. I thought that was just life and how life was, and I just wasn't as good at coping with it as other people. My name is Tasha, and I have generalized anxiety disorder.
Generalized anxiety disorder is a condition where people are really dealing with lots of intense worry that really interferes with their day-to-day functioning. Most people with generalized anxiety disorder worry about a number of different things. They might be worried about financial difficulties. They might be worried about bad things happening in the future. Often a focus is worry about health or safety of family members or loved ones.
I had some very specific concerns about my little brother's health. I had a younger brother, and I was always imagining and worrying about him getting hurt or being killed, and all these elaborate stories in my head that I used to run through. And you get stuck. The worry it takes over. You're prisoner to the worry. You know, it's hard to even have a conversation with someone about anything other than what you're worried about. It really just kind of comes in like a poison and just takes over everything.
The process for working on generalized anxiety disorder, there's sort of two main ways we can go about tackling this problem. One is using medication approaches, and the other is using psychological treatments. Probably the principal way that we work on generalized anxiety disorder is what's called cognitive behavioral therapy, or CBT. And what that involves is learning more about what anxiety is, learning more about how the worry develops, understanding what the thinking patterns are, and learning how to shift those. So that might mean things like looking at your worrying style. Is it productive worrying versus unproductive worrying? If it's unproductive worrying, how can we move that towards a more problem-solving focus? We also really encourage people to work on facing their worries in a realistic way, because that can help reduce the fear that's associated with the worrying.
Until I learned the techniques to relax and to overcome and address it and challenge those thinking, I was stuck. I was paralyzed. I wasn't able to make any change. Then once I learned them, the first thing is I can identify when I'm doing it. Well, you know what? I've been thinking about this for a while. I've been worried about it. What have I done about it? First thing I do, I relax my body. I calm down. I look and do my breathing, and then I start and I open up and I talk to someone about it. What I would encourage people to do is don't be alone in this. Don't think that life has to be anxious, that life has to be all about worry, and that it's somehow something wrong with you, that's, you know, that this is the life you have to lead. It's so easy to treat anxiety disorders, and it's so empowering to learn those tools and get that knowledge. The choice to focus on reality and things that are going to happen and not get carried away by that worry, that choice is opened up once you have the tools to deal with anxiety. Live each day and not let the worries take over.
Little things. When you're looking at generalized anxiety disorder, you do want to look at things like caffeine or stimulant use, because that's pretty common. Alcohol or sedative withdrawal, that's pretty common. And then there are a number of psychiatric disorders that have anxiety as a feature, but there are so many other features that they fall into a different diagnostic category. And then a variety of medical disorders, including our favorite field, sport. Okay. Medications to treat generalized anxiety disorder. Dr. Latas will cover this in much more detail, but again, the SSRIs, the SNRIs, benzos are good for short-term use, but you have to worry about dependence and sedation. And then unique agents like buspirone, non-sedating, does not interact with alcohol, kind of finds a role here, and then there's a variety of other things. So she'll actually group these off and rank these off in how you look at selecting for a disorder. Then the final thing, if you're depressed, you're living in the past. If you're anxious, you're living in the future. If you're at peace, you're living in the present. And I think when you look at these diagnostic categories, those are kind of useful things to look at. Because when you're depressed, you really can't move forward. You are stuck in a place, and it's not a good place, and bad things happen in your mind. When you're anxious, you're in the future, because it's always the expectation, apprehensively, of something falling on you or coming down the road. You see how disabling anxiety can be for a lot of people, and it's fairly common in the population as a whole. And you know, there's a lot of daily routine living is that, you know, you worry about your children. I sit around, I think about my son, I think, oh, I hope something doesn't happen. I used to remember just worrying that something would happen, and I think that's a parental normal thing. It's not abnormal to worry about your children, but you don't let it overwhelm you. But you can think about it and go, oh, and then you kind of just calm down. I know what's going on, everything's okay. And you look at it differently, but it's out there. It's when it becomes debilitating, like this woman. She really was more trapped. Okay, let me switch gears, go to OCD.